live little lunch and learn. We're eating key lime pie today. I hope you guys are too. You can send us what you're eating. We all would like to know what you're eating. We miss you all at Tareen Dermatology. My name's Dr. Wahiba Tareen. This is my colleague, Kelsey Holmes, who's our wonderful physician assistant. We're going to go through a few topics related to acne today. I'd love if you could post your questions and your comments. We've got lots of things that we're raffling off at the end for anyone who either questions or comments. So please let us know that you're here because we do all miss you. So our 5 topics today are going to be acne, what causes it, what are solutions, both face and body. We're going to talk about acne scarring because that affects a lot of people and really affects people's self-esteem. We're going to talk about a type of acne called acne rosacea, which happens kind of more in people my age and their middle ages. We get a lot of redness and some pustules, and that's called acne rosacea. Number 4, another thing that I luckily happen to suffer with as well, so I can go with you guys, is something called hormonal acne, where we get some of these deeper cystic lesions. This typically tends to happen in women along the jawline area. And last thing, really timely for the moment, is mask acne, because a lot of us are wearing masks and we're getting a lot of these little bumps under the mask area. Kelsey, you can chime in and tell us what you're thinking for acne.
Well, for the first thing, I just want to say that we do offer telehealth visits. So if you guys have any questions that come up that are very specific to you or your treatment, just let us know and we're happy to schedule an appointment because sometimes it's difficult to answer specific questions, but we're happy to take all of your questions, and if we think we need a visit, we're happy to do telehealth.
Yeah, it's really cool. If you have FaceTime or Android, it's really easy. You just click on a link on your phone, and we've been able to help a lot of people even who don't want to venture out of their houses at all and just even mail you the prescription. So that's a simple thing that Kelsey's right if it's very individual to you. So first, let's begin with acne, which is a disorder that affects probably about 80 to 100% of people at some time in their lifetime. Acne has 4 main causes. So I can come to you guys. This is a diagram of the hair follicle. For all of you kids at home who are doing virtual health, this is something you'd probably study in your health class. So the hair follicle is deep in the skin. It's kind of at the junction of the deep skin called the dermis and the fat. When the hair follicle gets obstructed with either inflammation or bacteria, that's when an acne pimple forms. If that obstruction continues getting bigger and bigger, that's when we get those big, painful, deep cysts that then take a long time to go away and then leave scars. So inflammation, bacteria, oil production, it all is related to that hair follicle. Now let's talk a little bit about some common acne treatments. So as dermatologists, we really individualize this to you, but in terms of common acne treatments, obviously there's really good prescription grade topicals. And probably the most common thing that Kelsey and I hear are that people have spent so much money on over-the-counter stuff, and then they come to the dermatologist and we will check, we will work with your insurance and find you something that's affordable. And actually, a lot of times it ends up being definitely more effective, but at the same time, more affordable. There are oral medications for acne. There's something called Accutane. There's a whole bunch of stuff. Tell us some of your favorite things about acne treatment, Kelsey.
I think my favorite thing about acne treatment, and it is very individual for people. If it's something, I always ask my young teenage kids, how much do you want to do to help your acne? And if it's something that they're only going to do something once a day, we can accommodate that. If it's something that you want to throw the kitchen sink at it, we can, give you a tailored regimen that has multiple different components that target all of those different causes of acne. So I think that's, we can accommodate a lot of different things and a lot of different skin types because everybody will respond a little bit differently to the different treatments.
Right, like sometimes people are like, oh, I haven't seen a difference, and sometimes it's actually interesting that the more mild variants of acne will take longer to get better, but we will see, a young teenage boy with really, really cystic acne, and we can give them medication, and that young man can be better in 2 weeks' time, and that really can be life-changing to young people's self-esteem, and even people our age of self-esteem, So one medication that sometimes gets a bad rap, that particularly for our young people out there, I want to discuss is a medicine called Accutane. Accutane is not the right medicine for everybody, but it is a great medicine, and it really is the cure for acne because it addresses kind of that overall oil production and the blockage of the hair follicles. I'm going to put her on the spot because she didn't know she was going to do this, but my colleague Mackenzie is behind the camera right here.
Oh God.
You can hear her laughing. And I love Mackenzie like a daughter.
Hello.
Hi everyone.
And I would give her a hug, but we're not allowed to do that. So she's going to tell you about her experience. I put her on Accutane.
I was on it for about 9 months, so I was getting like more of like the temple problems of like the large and like painful stuff right up here, and I had tried all of the pills, a bunch of topicals and everything like that, and then I decided to try Accutane. After a couple of months, I could see everything just like calming down, and more so like the texture of my skin was improving and like the tone of my skin. It got so much better. I was very dry throughout it, but that was the only side effect that I had. So I loved Aquaphor and like things like that and to really help. But otherwise I get minor like small little like pimples now, except they go away probably within like a day. So it's been very amazing for my skin. So I'm happy.
And the other thing that people forget is Accutane does have a little bit of an anti-aging quality too, because Accutane is just pure vitamin A. So Mackenzie is really 85 years old.
Good dermatologist.
Thank you.
Yes, you're welcome.
I always tell my patients who are a little bit of trepidations about Accutane, I have put my own family members on Accutane. It's not a medicine that we will put you on unless you need it. One other question we get is really commonly like, what are some good face washes? So Kelsey, if you want to kind of take that, that's a really great place to start.
There's several different types and categories of face washes, and probably two of the favorites around this office are benzoyl peroxide wash, because it has a lot of antibacterial properties to it, and it works on all types of acne. There's also some alpha hydroxy washes that help. They're slightly acidic and they do help to reduce some of the bacterial production, and some people can actually see a little bit of their oil production go down too with the alpha hydroxy wash. So these are the two that our providers recommend more often than the others, and they're really well tolerated by our patients. Dr. Tareen makes a skincare line, as you can see, and one of the goals of the skincare line is to make sure that our patients are able to use it. If you go over the counter and buy a similar product, it may work great, but I have a lot of patients who say they can't use it very often because it makes their face raw.
Right. So the goal in dermatology is efficacy with tolerability. So the nice thing about kind of these more medical grade washes is that they're effective yet gentle. So, but if you just want to buy over the counter stuff, the message that Kelsey and I want to give you is that benzoyl peroxide can be irritating as a leave-on ingredient, but in a wash, it's really nice. If you don't want to get this one, Clean and Clear makes one in a purple tube that I recommend to a lot of my patients. And in terms of alpha hydroxy washes, those are actually a higher price point than you can find in our office. Like this, I think is like less than $30, and a lot of alpha hydroxy washes that you buy, just over the counter are about $40. So this is a good price point for that. So face washes are a good place to start. Another thing we get a lot of questions about are dietary things, like what diet things can affect my acne. And I really want to let you know it is pretty personal to you, but there have been some particular studies on dairy. So really interestingly, dairy, particularly skim milk, can flare acne. We don't know why, in particularly the skin. It's thought maybe to be related to the meat and milk, the hormones in meat and milk and things like that, but that has been one thing that has been shown. Kelsey, anything else that you see commonly?
Other than that, it's when I always tell my patients in studies they don't see anything that translates across huge populations. But dairy is one that I see my patients a lot, if they can cut back on that. And then high glycemic index foods are the other category of thing that more reliably can help prevent acne. So high glycemic index foods are foods that release a bunch of sugar into your body right away. And most of this is like junk food is what falls into this category. There are a few others, but junk food is going to be the main one that's going to be easy for people to eliminate and potentially see a big difference in their acne.
Right, that's a good point, for sure. Body acne, as we're getting into summer, who knows if we'll be able to go outside, but body acne can really plague a lot of people, chest, back, shoulders. Washes are a great thing for body acne. Coming back to washes, benzoyl peroxide is probably one of the most effective things that you can buy over the counter simply for body acne. What Kelsey and I recommend is just lathering up those areas that are oil prone letting it sit while you're doing something else in the shower. Leave it on, 10, 20, 30 seconds, and then rinse it off, and you'll see a significant reduction in your acne. There are prescription things we can prescribe, but this would be a good jumping off point. Anything else you recommend for body acne?
The washes are really key. It's really difficult to get topical stuff on reliably, so I always recommend my patients start with a wash.
Right, I agree. Awesome. So we're going to move on to a little bit about acne scarring, because that affects a ton of people now. At the end, we'll take your questions and your comments, and then we'll have some fun prizes, and we'll mail them directly to you. So acne scarring also affects about half of the people who have acne, and that can be from one little pinpoint scar to deep box scars, or all red or all purple. So luckily in 2020 we have a tremendous amount of knowledge how to take care of these scars. There's simple things from light peels that cost less than $100 to really extensive laser treatments that cost about $2,000. So what are your favorite things for scars?
I always tell my patients actually the simple thing to start with is actually a topical retinoid medication. There are actually a couple of them that are now available over the counter, and it does not work quickly, is the biggest downside of them. But they do actually work, and when we always take photos of patients to try to monitor progress, and it really is surprising how, after 6 months, you really do see a very big difference if people are consistent with their topical routine.
And Kelsey's right, actually. The topical retinol medicines, these vitamin A medicines, they remodel the collagen, and they actually help even if then you do an additional treatment. So let's say you're using your topical cream at home and then you get a laser treatment. The studies have shown that the laser treatment will be even more effective because you're using your topical, because it's softened up the collagen and helped remodel everything. So Kelsey's right, the foundation are topical retinols, and then we can add chemical peels, something called microneedling, where we make little punctures in the skin and then induce a wound healing response. Deeper lasers, there's a whole list of things, and there's a lot of different price points, because honestly a lot of young people have acne scarring and they can't afford a huge laser treatment. So even little inexpensive things can really help acne scarring and affect, really improve somebody's self-esteem. We'll address your questions on acne scarring at the end. Let's move on to acne rosacea, which actually is a topic close to Kelsey's heart. My cute little Kelsey gets a little rosacea. You would never guess looking how beautiful her skin is. So Kelsey, you want to discuss a little bit about rosacea?
Yeah, so I've always had super sensitive skin. I have a hard time using a lot of the products I recommend every day to people just because of my rosacea. I have a hard time using things. So I always tell my rosacea patients, as hard as it is, one of the keys is to simplify your regimen. Use really gentle cleansers and moisturizers, because that's going to actually make a huge difference in your medications being able to work better if you're not irritating your skin and kind of going backwards as you go. So I use Cetaphil every day. I use Cetaphil and CeraVe for my moisturizer, and it's simple and it works. So that's a really key thing, is to keep it simple.
Right, I was just interviewed for a Wikipedia article, and the main fallacy that we see in skincare is actually using too much. So people are overburdening their skin, they're exfoliating too much, they're making their skin too raw. So, it really comes to just basics, which we'll talk about basic skincare towards the end, and really hydrating and keeping that barrier up, particularly as we get into our middle ages. We don't want to be overburdening the skin. I see patients come from other dermatologists, and they're let's move on to hormonal acne, a topic close to my heart. Hormonal acne presents typically in women who did not have a lot of acne when they were teenagers, and then in their 20s, 30s, 40s, 50s, 60s, 70s even, we start getting these deeper, almost underground cystic lesions that present really not as tiny pimples, but as deep underground painful lesions. And it tends to come in this jawline area, because that's where we have the preponderance of our hair follicles on the face, kind of this beard distribution. Then for some reason our hormones are interacting improperly with the hair follicles, and it causes these deep bumps. It doesn't mean you have a significant hormonal imbalance, it's just that your hormones are interacting improperly with the hair follicles on the skin. So there's a great medicine for that, that's an oral medicine, something called spironolactone, that I've been taking myself for about 20 years. Spironolactone works by blocking testosterone in the hair follicles so that the hair doesn't react against the male hormone quite as much. There are topicals that help, but that does tend to be a really great option. What do you see with hormonal acne, Kelsey?
It's actually one of my favorite things to treat because the spironolactone does actually make a really big difference in people's lives. The other thing I always tell people too is, especially for women, you know, after about the age of 18, at least a component of your acne is hormonal. That may not be all of it at that point, but using something like the spironolactone makes a big difference. And one thing I really took away, Dr. Tareen and I went to a lecture at the University of Minnesota a couple of years ago now, but one thing they are seeing in research is that back acne actually tends to be very hormonal for people as well. And I have seen really good results with the spironolactone. So even though the chin and the jaw is one of the areas that we all immediately identify as hormonal, I've seen really good results with back acne as well.
Fantastic. Yep. So there are really safe medicines that can be used long term for kind of this women's hormonal acne that is just so annoying to us. Moving on to our last topic, which is mask acne. A lot of our healthcare workers, a lot of people just who are, you know, hopefully wearing masks when they go to the grocery store are getting these tiny little pimples and pustules. I'm getting a ton of emails from my patients who are nurses and doctors on the front lines, and they're just like, it's making them not be able to wear the mask and help, you know, people who need to be helped. So I think the first component of this mask acne, it's both a mix of humidity, yeast, and bacteria. So it is multifactorial. So we kind of can hit it with some over-the-counter things just to start with, which we'll give you some recommendations for, and then if you need some prescription things, there are really some effective prescription things that we can treat. So one thing, the yeast component, you can buy something called Nizoral, which is an over-the-counter scalp wash, but it kills yeast on the scalp. And you can wash your face area with that a couple times a week, and it reduces your yeast colonization. Make sure you get a little bit of that wash inside the nose, because sometimes the yeast is in the nose. In terms of bacterial stuff, if you can start with one of these little like benzoyl peroxide or alpha hydroxy washes, that also reduces bacterial count on the face. And then as much as possible, try to, when you're getting sweaty, take off the mask, go to a private area, let your skin kind of breathe a little bit. Any other suggestions you have, Kelsey?
One thing I will say, just because I am prone to this, you can get a cousin of acne called perioral dermatitis that shows up underneath of masks quite frequently. And that is one of the things that it might all get itchy, but as much as you want to, don't put any sort of anti-itch over-the-counter cream on it, because it will, in the end, make it worse. So if you are getting that and it is itchy and things like the Nizoral are not working, let us know and we can give you some recommendations for that.
Yes, for sure. Just today, I've seen 2 people via a telehealth visit who got itchy mask acne and put prescription strength topical steroid on it or hydrocortisone, and it makes it better temporarily, but it actually makes it worse long term, and it makes you more resistant. So Kelsey's absolutely right. Don't be tempted to put, you know, other cortisone-based things on it. Awesome. Let's take some questions. I hope you guys had a good little educational experience with the talk, though.
Erin wants to know the difference between an ingrown hair versus acne, because they sound similar to her.
Great. You want to take it, Kelsey?
Sure. So technically an ingrown hair is when it happens most often in areas that have curly hair, but it can happen anywhere. So some people that have more curly or corkscrew type of hair, this tends to be a bigger problem with. But an ingrown hair, basically your hair will, instead of growing straight out and up, it will either come out and then curl back under the skin, or it never even makes it to the surface of the skin and it ends up curling back in. So sometimes you can get an ingrown hair in an acne-like lesion because there's so much inflammation that keeps that hair follicle from growing through the skin. So sometimes they can be related to each other, and a lot of the same treatments are used for both. I always tell my patients, in the end, it doesn't really matter how much of it is acne versus ingrown hairs, as long as the treatments are working for what you're doing.
And then just a addition to that was great. Laser hair removal does tend to be amazing, even in men, for ingrown hairs. You know, we never think about men coming in to do laser hair removal, but we do tons of laser in men, and it can be life-changing because then they don't keep getting those itchy, bumpy areas for the rest of their lives. So that's a good gift for the man in your life who gets ingrown hairs.
On that topic, Ellie wants to know if laser hair removal can help acne.
Excellent question, Ellie. Yes. We see that all the time, particularly for people whose acne is related to ingrown hairs. So if you find that your acne is predominantly right over little hair follicles and you see hair follicles with little white pus bumps on it, that would mean you would probably have an excellent response to laser hair removal. Will it take care of all of your acne forever? Probably not, but usually we see about an 80% reduction in acne with laser hair removal of those hair-bearing areas.
Holly wants to know what's best for acne scarring on the body.
So it really depends, Holly, in terms of your acne scarring, what it looks like. We see for superficial acne scarring, like on the chest or the shoulders, sometimes the most gentle chemical peels, just by resurfacing, because the chest skin is so thin, that can be really effective. If you conversely have really deep acne scarring on the back, a light peel isn't going to do very much for you, So sometimes we have to see where the tissue location is, so if it's like a thin area versus a thick area, and B, what the characteristic of the scar is. So microneedling is a good in-between where it addresses both. Microneedling is a device that uses tiny little needles that stimulates collagen, so that's an overall effective treatment for kind of almost any area. Anything else you'd add?
The only other thing I'd add is that it's relatively common to get acne scarring on the chest and back that's actually raised. These are particular types of scars that sometimes some of the treatments can overlap, like microneedling can help with those types of scars as well. Sometimes you need to be a little bit more aggressive with those raised types of scars. So we're always happy to take a peek at it and kind of make an individual plan from there.
Kayla wants to know, a lot of her breakouts are on the left side or on one side. Is that normal? Is that hormonal?
So sometimes we look at where you keep your phone, Kayla, because sometimes, we see it all the time where people are either keeping their hand there. So kind of look at your habits first and see if that is it. Usually hormonal acne, because it's coming from inside of you, tends to be relatively bilaterally symmetric. So there may be an additional factor, maybe you sleep on that side, etc. But hormonal acne, because it is from inside of you, is relatively symmetric.
Stacy says that she breaks out before her period. Is there anything that she can do to prevent that?
You want to take that, Liz?
So this is typically that very characteristic hormonal acne. So that is something that I would say schedule a visit. We'll go through particular care plans with that. But that's the classic hormonal acne, is that week before your period where everything starts popping up on you and you think, here it comes.
Yeah.
So that is that very classic hormonal acne.
And the problem with that, even though you are just breaking out once a month, because those cysts are deeper, they tend to leave red marks or purple marks for the rest of the month. So it's kind of this continuous thing.
Denise wants to know if there are any side effects from spironolactone.
Any medicine can have any side effect. As I tell my children, nothing in life comes for free, So spironolactone, the main side effects, you can get some headache, some menstrual irregularity, and some breast tenderness. There was a controversy that potentially spironolactone increased the risk of breast cancer, but that has been disputed in very large scientific trials. So when I first started as a dermatologist 15 years ago, I would counsel people that if you have a strong family history of breast cancer, don't take spironol. Now we know that that is a fallacy. My dad is an oncologist, a cancer doctor who specializes in breast cancer, and he is comfortable even putting patients who have had breast cancer on spironolactone if they need it. So a few little things that we would, again, as Kelsey had said, we would individually discuss based upon your risk factors.
Deborah wants to know how diet can affect more mature skin. So even though she doesn't have acne, how can diet affect that?
So that's a great question for our Wednesday session, Deborah. We're going to be doing a whole session on skin care, anti-aging, etc. But in general, obviously, a balanced diet, good protein. We like antioxidants. If you can get a little extra vitamin C, vitamin D, vitamin E, those tend to be good. Kelsey and I love good fats, fish oils, avocado, salmon. Those keep the good, plumpness of the skin.
Holly wants to know if red light therapy helps to reduce acne.
So there have been some studies that show that some certain wavelengths of light can help reduce acne. I will say it's one of those things I don't routinely recommend to my patients because it tends to be expensive. And the amount of improvement that the studies have shown, tends to be a little hit or miss. So some people it works great for, some people it doesn't, but I think that's usually not our first go-to recommendation.
red light and blue light have been studied. Almost every wavelength of light has been shown to help acne. Light tends to be beneficial, as you might see when you go on vacation, you get a little sun. It does help, but at what cost, because sun can also lead to skin cancer. So like Kelsey said, there are other safer, more reliably seen things that can help.
Linnea wants to know if rosacea can come and go. She noticed that her face gets red some days and not on other days.
Hi, Linnea. Yes, rosacea definitely comes and goes. That's the hallmark of it. I love when I see my cute little Kelsey flaring sometimes and not. Since it's personal, she'll tell you her flare trigger.
Yeah, so I usually will flare when someone puts me on the spot. I also will flare, at different times of the year. I am developing adult allergies that are getting worse as I age, and I can definitely tell when it's starting to become allergy season because my rosacea will definitely be acting up more than normal. I have a lot of patients, it's a spectrum. Some people will get way worse in the summer, and others of my patients only use their medications in the winter because the weather is a very big trigger for people.
What is your opinion on washing your face with coconut oil? Jill is asking.
So as an Indian woman, we love coconut oil. If you go to India, you'll be like greeted with coconut oil when you get off the plane. So I'll just let you know I'm a little bit of a biased subject. So coconut oil is great because it's a very anti-inflammatory, but it also is one of the oils that's called comedogenic, which means it does block pores. So if you're very dry and rosacea prone and you're not prone to a lot of acne, coconut oil would be a great wash for you. But if you're acne prone, then it's not a great wash for you. Oils that are not comedogenic, sunflower oil is a non-comedogenic oil. You might want to try that. Sweet almond oil is a non-comedogenic oil. Those are natural oils if you want to try them. Any other suggestions on coconut? Do you like coconut oil for your own self?
I don't use coconut oil. It's just one of those things I use, more reliable Cetaphil for me, and I've never had to stray from that. I have some patients who swear by coconut oil, but I also have others that come in because coconut oil made things worse. So that's always one of those that's, it could work, it could not.
A little trick that we as dermatologists use is this inner arm skin actually mimics the thickness of facial skin. So if you are concerned like, hey, I want to try coconut oil and see if it works for me, you might want to try washing here every day for 3 days and see if it causes breakouts. And if it doesn't, you might want to try it on your face.
If someone's breaking out from spironolactone after taking it, would you suggest a higher dose or a different hormonal medication?
So all acne medicines can cause a little bit of a flare. If you are breaking out, I would say 4 or 6 weeks after, probably just power through it, get to, 2-3 months, and let's see where we are. We can always go up on the dosage. Typically in dermatology, we start at the lowest dosage of spironolactone, 25-50 milligrams, and go upwards. Almost all hormonal acne does respond to spironolactone because it's treating the root cause, the response of testosterone to the hair follicles and the oil glands in the skin. So if you are at a high dose, 100 to 200 a day, and you're still breaking out, we got to do some investigation. That might mean, God forbid, you have a kidney tumor, an adrenal tumor, something, in that whole hormonal axis.
Brenda wants to know if you can get rid of bigger rosacea bumps on the face. Do you think they would just come back?
I'll let you take the rosacea question.
So part of this depends on what it is. Rosacea bumps don't tend to be very big. If they are bigger, it may mean you also have a hormonal acne component of things. Sometimes you can get little growths too called sebaceous hyperplasia that some of my patients will confuse with part of their rosacea because they can show up in the same person. But yes, there is no cure for rosacea at this point. So if it is truly a rosacea breakout and bump, if it goes away with medication, it may eventually come back. But if it's something that's not going away, even with your medication, those are things we want to take a peek at to make sure that we know exactly what it is.
We have time for one last question from Haley. She wants to know your recommended skincare for late 20s.
Since I'm really far away from that, I'll let Kelsey take that.
Not even.
You're not.
So again, this partly depends on your skin type, but I will say it sounds like you're trying to get into that, what should I do to start an anti-aging routine, is I'm guessing what the question is getting at. So I do like either a gentle cleanser or the alpha hydroxy wash, vitamin C serum. Retinol is another standard anti-aging treatment that we start people on, and the earlier you start these things, the better results you see in the end. And then sunscreen is key. This is the key for those in your 20s people who are not quite to the point where you're starting to see wrinkles or sunspots. Once you start hitting your late 20s, those start showing up and people get a little more serious about putting their sunscreen on. So start now, you'll thank yourself in 10 years.
And I'm going to put these two young ladies on the spot. I have my assistants, Seema and Nicole, and they're going to tell you their favorite things for a little bit of acne, since they're young ladies in this kind of prime of young acne.
Yes. I'm actually on spironolactone as well, and that changed my life, honestly. I was breaking out all over my face in this hormonal acne, and I tried everything over the counter. And sometimes it just takes a visit to the dermatologist's office to find out that, you know, sometimes the hormonal acne needs a medication. Sometimes it needs something prescribed by a doctor or a PA to get you in the right spot. Otherwise, I love retinols too, because I'm prone to dark spots and scarring, so adapalene or that over-the-counter version is a great option for me.
Yeah. And as you can see, I'm similar to Kelsey. So I use gentle cleansers like CeraVe, Cetaphil, and that's, I mean, I swear by it as well. So sometimes if I'm getting a breakout, I'll spot treat with adapalene, which is a retinol. But other than that, I pretty much just use all gentle cleansers and moisturizers.
Amazing.
Awesome. Thank you, everyone.